Hi everyone, thank you for joining me today. My name is Eugenia and I'm a registered nurse here in the state of Texas. So I've been doing some daily updates ever since I learned that I was working with a COVID-19 positive physician in the place of my employment. So I've been quarantined so far. Today is day 7 since I was notified, and day 10 since I was exposed to coronavirus positive person. So I've decided to just keep doing these daily updates in both of my languages, in Russian and English. So if you're interested in learning about the information I was able to find for today, please stay tuned. Okay, so let's start with the basics. I'll just give you a couple quick updates about my health. I'm doing fine. I still have some cough. Dry cough. I had a video recorded yesterday. I had to cut out so many coughs because it was just so loud in the video. But it's still pretty common for me to have cough, but thankfully I don't have any fevers. I even stopped checking now because I feel just fine. So I feel like I'm blessed to be at home on quarantine with my family, and I feel more concerned about you guys out there who are still in the front lines in essential areas like grocery stores and deliveries and food services. I appreciate you guys for doing your work and supporting people that are staying at home. So as far as numbers go, obviously the problem with testing still persists. Donald Trump announced that Walgreens, CVS, and Walmarts will use their parking lots for drive-through testing facilities, or stations, but still we haven't heard anything about that. That's a big downfall on their part. So we're currently fighting this invisible beast, invisible enemy, right? That we don't know who is who and who's sharing it and who is sick and asymptomatic, and the hospitals only test currently those that have confirmed pneumonias, right? And it's really hard to get tested. So that's a big problem. I just updated some of the information, but it could be already different numbers at this moment. It changes constantly, almost every minute. So yesterday USA was on the 6th spot on the list in the world. Today USA moved up to the 3rd spot, only after China and Italy. Our total case number is 38,757. And that's an increase by 14,500 patients, and the total death number is 400 people. My condolences to all people that have disease, that have lost their loved ones during this process. I'm very sorry for your loss. So Spain is on spot number 4, then Germany, Iran, France, South Korea, Switzerland, and UK. You all guys can look and track your country's numbers if you're from a different country. I'm gonna leave a link below where you can find the information. So I feel like today, since the enemy is really invisible and unpredictable, we have to kind of come to terms with this new way of living, right? So initially we were all kind of in denial, and that's a normal stage of adjustment, just to deny it, like that's not going to happen, that's not going to touch me, this just can't be true. Then we went into this shock mode where everybody's sharing the news and looking for a source of hope. And at the same time, the sense of fear was kind of overwhelming. What we're going to do, how long this is going to last. And now I feel like we're really in that stage where we should be starting to adjust to this new idea that this is what's happening and it's here to stay for a while. So how do we live now? So as far as community living, right? I live in the house. Our streets look pretty empty. I haven't been outside of my home for over 7 days now. A couple houses being built down the street, those been abandoned pretty much. There's no workers there, and the exposed wood is probably going to rotten. It's been raining pretty badly, so that's definitely one of the things I can see on my street that's affecting people. But otherwise, our community kind of stepped up. A lot of people volunteered to go get grocery food for elderly. People are trading things like toilet paper for bacon and stuff like that, which is kind of surreal. Like, for example, I bought some popcorn someone was selling in our community Facebook page. I left the money under the rock in front of my door, and someone came, drop off the popcorn, and took the money. So people really try not to interact with each other, not to get each other sick. So that's a positive thing. So school's been closed, so no one really goes anywhere, but you can still walk outside. So people came up with this idea to put little bears outside of front windows, behind, in front of the blinds, so that when parents go for a walk with kids, they can count the bears, stay entertained. So they call it a bear hunt. I thought it was super cute. I stay in touch with other people on our street. One person's really sick, has severe cough. They think it might be bronchitis. He's now coughing up some blood too, so that's kind of scary. He's been to a primary care physician who ruled out the flu and strep throat, but testing still could not be done. They put him on a waiting list, and today his wife finally texted me that he was tested, but it's going to take 3 to 5 days. Primary care gave him some inhalers, some steroids, but I'm just advising everyone, if you have symptoms, please stay home. If you can breathe on your own, stay at home, because you might be having something else and you're going to go in those high-risk areas and contract COVID-19, and then your body is already going through a lot and stressed and immunocompromised, and you might get sicker. So if you can at any cost, just stay home. Also talked to my workplace where I was exposed, so like a worker compensation department, human resources. It seems like I'll be paid after all. It's all new. Everyone is kind of in that state that this is such a new thing that no one really knows how it's gonna evolve and what to do with it. I was told though that people that are full-time workers in the hospitals, if they will get sick or have to stay off of work due to health reasons, even if they run out of their PTO, paid time off, the hospital will provide up to 80 hours of PTO. So that's good. That's like 2 weeks worth of pay. How we're gonna live now, right? It's a new way of life. Try to reuse food, as much as you can, different supplies, stretch them as much as you can. I feel like that's very healthy for Americans to kind of learn a new way to be more mindful about the environment and things that go to waste every day, right? So not letting food spoil, rationing your supplies, reusing things. I feel like this experience will teach us how to maximize what we already have, how to be content with what we have, right? Not to go look for another next new thing. Most Americans stay at home, many cook from scratch, so that's good. I feel like it's going to be a good money saving, for those that still can work from home, because not going out means no impulse buying, no shopping, no eating in the restaurants, so that might be a good thing. Trying to be positive here, okay? Don't judge me. Schools still closed, and the date was pushed back. I think now the latest information was till April 6th. Obviously there's a concern about what's going to happen if you're unable to afford rent or mortgage or bills. So at least where I'm at, we were told that the city will not shut off electricity or water for unpaid bills, so that's good news. I think New York State was the first one to postpone all the rents and mortgages to provide some relief for families, which is good. I'm not sure about what's going to happen with rent. Maybe it's going to go on people's credits, but I think my husband told me most likely what's going to happen is that with mortgages, they're just going to add on an extra year. So like, let's say if this thing goes on for a while, they're just gonna, like those that bought a house for 30 years will now have 31 years and stuff like that. So had some loss there with the interest, but at least that would provide some relief for people to be able to stay at home, not worry as much for money. This thing will go away eventually, so the best two things that we can look forward to is that everyone will comply with the quarantine, stay home, so that way we can slow down this thing or even stop it. Imagine if everyone was just to stay home for 2 to 3 weeks, especially those that are sick, their family members should stay in, right? So that thing will blow over just because there's no way for it to spread. And then it lives on the surfaces for up to 72 hours. Once the quarantine is over, even if people were sick in their own homes, after 72 hours that virus is gone, right? So technically, if we all stay in, we can stop this thing from spreading. And then vaccine eventually will be developed. Let's say even if we have to wait a year or so, the vaccine will become available so we can protect those that are immunosuppressed, elderly, kids, pregnant, stuff like that. And then so of course the main thing would be to find medications that will help treat symptoms. So Donald Trump announced in one of his speeches that there are 2 medications that were confirmed by France to be effective against COVID-19. So, and those medications used together provide even better outcomes, and people are able to recover a lot faster, so more hospital beds will be available for those that are still sick, and people are like completely symptom free. So 2 of those are remdesivir, which is, I believe, is a new drug that hasn't been approved yet, but it goes through a lot of like research stages. And then the well-known hydroxychloroquine that's used for RA, rheumatoid arthritis, as well as malaria. So I think from what I've heard, those medications affect the way the RNA doubles. So that's the way that virus spreads through the body, right? It's not like a bacteria that can just multiply. 1 became 2 cells, 2 became 4 cells. So virus actually hijacks the nucleus of the cell and makes it produce RNAs that basically produce the virus inside that cell and spread it. So if we can slow down that process of RNA multiplication, then we can technically prevent virus from spreading through the body, and of course create a lower viral load. Lower viral load means that body has more time to overcome the virus. So let's say if someone coughs straight in your face and you inhale a huge amount of virus, the virus hijacks all those cells all at once, and now you become infected, and your symptoms can develop as soon as 4 hours. But the lower viral load, if you were just to get a little single drop of virus in your eye, or someone just walked by, right, or you walked in the room where someone sneezed 4 hours ago, then the viral load is very little. So your body has time to attack it and destroy it. Or also, even if you're immunocompromised, at least it takes it longer to hijack your body and really overcome it and really start showing symptoms. So that can take 4 days or longer. So that's why I believe some people able to overcome it and some people get really, really sick. I think it depends on the viral load that they receive. And also, important thing I think to mention is that I'm hoping that those that got no symptoms or very little symptoms from exposure, their bodies now are aware of the virus and able to produce antibodies and create an immunity against it. So hopefully we can reach that immunity, right, herd immunity faster, because you might not know even that you're sick, but you've been exposed to it, but you were able to overcome it, but now you're immune. Of course, you can still spread it. So like if you touch this surface and now you touch that surface and the virus was here and now it's there, you can still spread it, but you won't get sick with it. Potentially you will be able to go back to work. The goal is to wait till vaccine is available and get everyone vaccinated, to come up with medications that will be able to help recover, help treat patients with COVID-19, and also herd immunity. So eventually we're going to reach 70-80% of population, and then once we reach that number, it's basically the pandemic's going to stop on its own, because there's no one else to spread it, to, because most people would already had it and built immunity to it. So that's my update. Please let me know if you have any questions. I'm not getting paid for it or anything. I'm just sharing the information that I found. I know not everyone is in medical field, but that's kind of mainly what I'm interested in, because that's the field that my head is in, basically. Please let me know if you have any questions. I'd love to answer. I'm just happy to be able to share this information with you while I'm at home. This is kind of an outlet for me to share the information and express my frustration. And I hope that we can help each other manage this stress and the eventful month of March. Thank you for your time. Thank you for your support. I appreciate all the nice, kind comments. I welcome your questions. Please stay in touch, and please keep your elderly safe. All right. Thank you. Bye-bye.